Shas Twisazani, Roshik Asian and Anotlani, Shady Kodo Profilia Fowler, additional. My deshkish nin slon to the chini bashes chain, Alo Trapan Dashacheva, Lache Dashanale, Na Kita Moj and Nahor Jish, Na Kido the Mois Can, Ado di Benny be hon and Linin hitch nail e, Ado to the Linishin Kodo, Be Anadi Nil. Codojodolle Shamana Hassan Yadalhil Zalisan Twisan Halchel Tia Halch Ewan Niajan await need long codon to Nadilson Arquij Incon to Dilson Ara Dihan Endale E the Questnas aids are Dapedi Nini Ban Nahanne Don Nihiden Endlini Bill Ishtan E Nilsen. You get eat Handolle, though ye not Tindolle. Hala dot eight acon at the hit hanjikish, ni hit adult dog ainiten, ado the neta is a indo atla anazan or con habit von londole, a lange de nishin hits a lam lini, ado to last chim, ado is a il and a bitlas angon he is a il and is a nika, so that alt not ani dan lini con a lange de nishi, na haba akon yandole, ado one has angon contact kilo. Wanish Kishnas Congo, Adahon Tunas Congo, Yat Echo Nahot at Ole, Adon has twin Hizani, Linicon, Bana da Holiadole, Artso, Naha Holiadole, Ata Anizinon, he hit Adolin, he seat Arjet, Naha Holiadole, Adakon and Tin Lini, and Nadil Netole, he is the eight and a Hashin so Kodo, ye and Nihi Kodo, and he did never Iljan Ilsen. Aro yat an hil nahot atole yat an hil nahast anole aide eisen hit so de zindon hi yin na khana hilaton na khata de yin na kha insen kon sabo eya to de zindlimi be anan ishlado bela ishlado bo ishlai ben na hal ne tole in den enda natlini adi de ben hit hojanasli. Thank you, everybody, for tuning in to our live weekly town hall. At this time, we will be sharing more information from our leadership and our healthcare professionals. Kokodoshi e yan hinat ani lini bakwidil ato han and linin hiche ananitle dole sotile Honorable President Jonathan Nez.
Thank you, Dr. Fowler, and the prayer here and Hatsudin Zinigi. Although every Tuesday at 10 a.m., we provide you an update on COVID-19 and also the monkeypox. Just to let everybody know, the monkeypox cases here on the Navajo Nation are still at 4. So that's a good thing that we are able to keep the spread down on Navajo. So here, then he did need all this. Not so quick. The Yahanash ni monkeypox will yego. Ado ni hichi ni zeb gidast here. Contra do ka do hand sanitizers chadash in because of the hand sanitizer use, the mask usage, we're able to keep the monkeypox from spreading. But as you will be told today, the COVID-19 numbers are starting to increase. It's getting colder. So please let your family members know about the importance of following these protocols. 2 years in a row, we've seen during the holiday season, during the winter season, an increase in COVID cases, a large increase. Halloween, Thanksgiving, Christmas, New Year's, even as into January or February with Super Bowl season, you see an increase. And so we should, continue to follow these guidelines. The Thanksgiving, though, Keshmish, Kung asahande ni hikeni hinapel. Ako hadainos nen tadi nene jo a kudohan net ni je kundel ne tiche ado ata hosya. O shi le hagande shi asahande itle hende. Aba soft hit. Ani hisbeda hansen shik enoslini. Na kido balah na khik at kudo hanet ni je kundel in. Even nakshi ya di nasnigi giego do dendel kit akonda. Thanksgiving, Christmas, do New Year's yo. Ya dendel kit at na kinach ya bazinia. Ado anahacha kon de kus. Ni eni hinabin da delna. Flu, yeah, influenza. Eshi do azebik na nishigi vaccination kon ta hallo. Zel enagon ndaznelo. So Ashido Nakada at Setole, the vaccinations for influenza and flu are available throughout the Navajo Nation at our healthcare facilities. And so is the new Omicron vaccine is available at our healthcare facilities. And then there is also an increase throughout the country in children getting sick. Um, and Captain Johnson will talk a little bit more about that. But we also need to make sure that our children are vaccinated uh, with from COVID-19, catching COVID-19, and also the influenza. And so please, just take care of one another at home, and all the viewers that are watching today. We say good morning to all of you and thank you for tuning in. I know that 2 years ago, last year, there'll be a lot of viewers, but I think we're starting to not continue to follow these guidelines. You can see that uptick happening all across the country, and it just happens to be right around the holidays. So we ask you to continue to follow these protocols because it's going to be, this is going to be the third year of COVID-19. And, my son, Christopher Nez has been studying, these types of pandemics. And what he was interesting in is that 3 years of a pandemic, you see people catching more of the virus at the third year. And it's because people tend to stop following the guidelines or they think that we're out of the clear. And that third year sometimes is the most devastating. And we don't want that to happen. And let's stay the course and help each other out throughout uh, these difficult times that we're going through. So today we have on line, we got Captain Johnson, who is the acting Navajo Area IHS Director. As you know, Rosalind So is now the IHS Director nationally. So, Captain Johnson, thank you. And then we have Dr. Jill Jim with us as well, and Del Yazzie of the epidemiology. And then Dr. Fowler will finish us up with the Navajo translation. So, Dainoth nido o here hada iso kizdo dan hinatligi ado ishibin nacha ekodo hanen hijikona de leto. Take care of yourself. God bless you. Please get your vaccination. We'll be out there at the vaccination events once again to encourage people to get their shots. God bless you, and God bless our great Navajo Nation. So I'll turn the time over to uh, Captain Brian Johnson, Navajo Area IHS. Captain.
Thank you, President Nez. I appreciate the opportunity to be here yet again on on a town hall session with the Navajo people. Appreciate everyone tuning in. And certainly a lot of activity going on around the country in terms of various diseases. Of course, it's time of the year when we around the country are heading indoors more so than we have in the past months. And it's whenever we all are indoors more often or in tight spaces, quarters, it does lend itself to disease transmission with infectious diseases. And commonly, we see that many of the diseases we deal with, at least these days, are the influenza virus. And this is something that we're all accustomed to dealing with every fall. And we all receive word about getting our vaccines or getting our immunizations for the influenza virus. And then, of course, we have COVID that we've been I guess, battling over the last 2.5+ years with the pandemic and doing what we can to battle that. There are other diseases that also take place during the fall months that we oftentimes see as we go into the winter. And one of those would be the RSV virus that many parents have heard about over time. And so that's another disease that certainly we do keep an eye on, and there are others types of infectious disease additionally. But we also know that monkeypox has been something that's been of concern, not only nationally, but regionally and locally. And we know that the public health team here on Navajo Nation, oftentimes led by Dr. Jill Jim, working with the federal sites as well as the tribally managed sites here on Navajo Nation in terms of making sure that we have the right public health response available and activated. And I just want to express my appreciation for all of those workers who are involved in those efforts. Oftentimes they're unseen, they're kind of behind the scenes, if you will, doing the great work, going out and visiting homes, also having the immunizations or vaccination events at the local healthcare facilities. And it's such an important part of making sure that we have a healthy population here on Navajo Nation. And oftentimes I join in meeting or at least attending some of those events, whether they be drive-throughs or if they are vaccination clinics at the healthcare facilities, just to say thank you to our staff members who are doing a lot of that type of work, including nurses, we have security guards, we have providers, we have infection control personnel, and these individuals are available at each one of our locations as well as the tribally managed facilities as well. And again, I just want to say thank you to the team out there and for all the support that the Navajo Nation leadership has provided to that as well. Because we know that with COVID, it's been a long run, and we know that we can't let up in terms of vaccinations. We know just how important that is. We always say that's the best tool in our toolbox in order to fight some of these diseases. If we can get the vaccination levels, immunization levels to be higher, then that's where we'll have the most impact on our population in terms of preventing or limiting the severity of disease. It's a little bit crazy to think about, but just as of earlier this month on October 11th, when we talk about specifically IHS, Indian Health Service nationally, looking across the nation, the country, we know that there's been over 4.8 million tests performed by IHS and tribal facilities. And of those, over 535,000, or about 11.8%, have been positive over time. And the 7-day rolling average of positivity, meaning for a 7-day time period, what is the positivity average of those tests? As of October 11th, it was at 7.6% nationally. And we can compare those numbers to what we see locally here on Navajo. And we know that Navajo nationwide, that we've been sitting in that 10% positivity rate for quite a while. And now we're bumping up a little bit. We're having an uptick, as President Nez mentioned, about with COVID-19. So we were enjoying some lower numbers for a while, but we're starting to see those upticks. And also, as President Nez pointed out, a lot of these larger events, folks gathering more so. And of course, we have the upcoming holidays, and we all just have to remember that while we want folks to certainly enjoy their holidays, I know I will do my best to do that, but also do so cautiously and carefully and really thoughtfully about how we interact and gather, and trying not to have massive indoor events, particularly unmasked. It's the wearing of masks can't be stated, the importance can't be stated enough as we continue to move into this fall and winter season. I also just wanted to mention that when we think about, and I'm talking specifically about COVID-19 right now, we talk about some of the national information on COVID-19. We know that if we look at those age groups 65 years and older, at 71.7% nationally. But we know that we're doing much better here on Navajo with that age group. And I just want to thank everyone for that. And I encourage those listening to keep up the good work, particularly with our elders, because they're so critical in all of our lives, and making sure that we're protecting them. And we know that as we go down in age, we look at age 18 and older nationally. We know that the percentage of those who got a primary series of COVID vaccine is at about 58%. And this is a critical age group, 18 years and older, all the way up to 64 years old. And we can do better nationally. And I know on Navajo Nation, we're doing better than the national statistics, but we can always do better as well locally. We really need to encourage folks, if you have not had that primary series, to please do that. That will make the difference between either catching or not catching COVID, or possibly if you do catch COVID after being vaccinated, the severity of the disease, whether or not you might end up in the hospital, can be greatly reduced by making sure that you have that primary series along with some boosters as well. So I won't go through all the age groups, but what we do know is that we're at a point in the pandemic, we're at a point with other diseases as well. When we talk about influenza and RSV and others, the immunization status right now is so incredibly important. And I thank the Navajo people for working hard to achieve higher percentage rates. And I thank those who are working in our health facilities to do that as well. And I want to thank the leadership of Navajo Nation, particularly with their public health and just general leadership in general, because everyone's playing a role in advocacy and carrying out the work, and then making sure to bring their family members in for those vaccinations. So we do appreciate that. Along with the primary series with COVID, we talk about the Omicron booster shots, but really what we need to focus on in general is just booster shots. For those who have had the primary series, it's, we're at the stage now where children all the way from ages 5 through 11 years are also approved as of earlier this month on October 12th. The Omicron booster shot, sometimes you might hear it referred to as the bivalent booster shot. But for the most part, you just need to know it's the new booster shot that came out this fall. And we do now have everyone from 5 years of age on up is eligible for a booster shot for COVID-19 of the Omicron variant, which is very important. So I want to just encourage folks to continue doing that. continue pursuing the vaccinations, the booster shots. Just can't say enough how important that is. It will continue to save lives, and it will continue to protect family members from getting very, very ill as we move into the winter months. So I'm not going to go into a whole lot of greater detail. I know we have Dr. Jim coming up after myself, but I do want to say that with these infectious diseases, again, influenza, you are able to get that shot, get that vaccination along with COVID-19, whether we're talking about the booster or the primary series. You can also get the influenza vaccine at that point in time at the same time, which is very handy for not having to go back and forth travel-wise. And I wanted to make sure that parents are really paying attention, particularly those with young, to the RSV virus. We know that there are some serious cases of RSV going on around the country. We do know that there are increases that are increasing hospitalizations with RSV. And we want to make sure that we notify the public earlier, sooner rather than later on that, because we deal with that seasonally. But just wanted to make sure that I mentioned that while we were on this town hall. But I just want to thank everybody for your continued perseverance in the prevention measures, washing your hands, wearing your masks indoors, limiting large gatherings, and we'll continue on these town halls to share information that's important to you. And at this time, I'm going to go ahead and turn the time over to Dr. Jill Jim, who is the Executive Director of the Navajo Department of Health, and we really sincerely appreciate her leadership throughout this pandemic and appreciate her partnership as well on so many other public health topics. So, Dr. Jim, the floor is yours when you're ready.
Hey, thank you, Captain Johnson, for that. Always appreciate all the things that I think we want to address every year before this pandemic happened. These are things that we dealt with as health facilities and health professionals, trying to keep our flu numbers down. Every single year, we try to prepare and try to encourage our kiddos to get vaccinated and making sure that there aren't a lot of sickness. And unfortunately, I think that has always happened is that I remember looking at statistics before the pandemic where the Navajo area office had, we always sort of had high numbers for flu and hospitalization. So it's very important. Now, it's not only related to flu, we have COVID, and then going into the cold weather that we have, and we really need to take care of our grandmas and grandpas. So other things that we know, even though we have some restrictions and we don't monitor everyone's household. I think that's where it comes to individuals to help make those decisions at home. And most often people don't get sick at going to the grocery store or other areas, but it's when you're in a situation where you might not be in a good ventilated room. That's where wearing your mask is important. And although the isolation guidelines have changed for the Navajo Nation and CDC, we don't necessarily require people to quarantine anymore if you've been exposed to someone with COVID. So I think that's sort of different now. And sometimes some of us might not be used to accepting people coming and being around people, but that's where the mask requirement, having a good quality mask if you're out and about after your recovery of COVID, because it does take at least 5 days to 10 days to not have any fever and you're out and about. But if you are infectious, I think that's where it's very important not to try to expose others or get others sick. So and people can wear their mask in their household and they can sanitize. And when you are sick, you aren't really up to eating all sorts of food. So I mean, one thing you can prepare, and we did this during the pandemic, is just reminding everyone to prepare when you do get sick. I mean, you can have cans of soups and crackers things like that, just stocked up just in case, so you don't have to go out and about when you get sick. And then also don't ever underestimate the COVID as well. I mean, if you don't have a lot of symptoms and you have fever, I mean, at least get a PCR test done at the hospital just to check. And then you do have your home test kits when you're not sure. And sometimes it's not completely accurate. So sometimes you have to be assured, and that's when you have to go and get a PCR test at the hospital, and the public health nurse will check on you and work with you to make sure you're okay, and then encouraging you as well. And because there are differences between maybe if you're unvaccinated or if you're high risk, you want to get treated early too. So that's why they have test to treat programs too for COVID. So if you have if you have an underlying health condition or you're older and you're not, you might not be strong enough to fight off the virus, and it might be more difficult. So that's why they have Paxlovid for you as well. So those are still available. And I think we're just encouraging everyone to start making those decisions and kind of just transitioning into this new normal. You don't want to really think it's a flu, but we don't want to also think it's completely unavoidable in a way where we have experienced before where there were high death rates. And over time, I think vaccinations have helped. And then also these strains are behaving, the strains of the virus are different too. So we keep hoping that it will continue to be causing less severe illness too. So just want to make sure that we are still aware of this and it's not completely gone away. And that's where, and sometimes you're right. I mean, even though we get vaccinated, yes, we will still get sick, and we hope we're not getting as sick as we would be without the vaccine. And so that's really up to everyone to make that choice and protect yourself. But you want to get as sick as more so if you weren't vaccinated. And so I think that's where we're at, and trying to remind everyone to kind of be informed about it. And I think that was sort of with monkeypox too, where we're continuing, and we think our field staff out there with the Navajo Nation and health facilities we're at the fair providing education in Navajo and English, because it is a disease, and we're all like, okay, well, how does this respond? How do we respond? It's not as severe as COVID, and it's not completely fatal. And so how do we prevent it? And I think that was a lot of questioning, and everyone was curious, and it's good. So I think that's things that we need to alert the public when numbers go up. It's very important that we begin to say, okay, the numbers are going up, but our hospitals are not getting impacted, which is very good. And although we say all of these recommendations, it's really up to your own household when you're at home. And then when you do go out into the community, you might be invited to a trick or treat at the school or the chapter or somewhere else outside the Navajo Nation, and just wear your mask. And sometimes I always appreciate it when people that are listening always say, I wear my mask even though others are not. And I think that's a good sign. If you feel like you need to, you need to, and you will. And that's really up to you to say, well, I'm protecting myself from getting sick. It's not more like I'm sick. And so I hope people have adjusted to that. And people still wear their mask around and about when you go to Flagstaff, when you go to Gallup and Albuquerque. You'll still see a couple here and there, and which is fine. And I always feel like I appreciate it when I see other people wearing their mask. It isn't required outdoors per se if you're 6 feet or more. So I know we'll be adjusting some of our public health orders and restrictions, but I'm just encouraging everyone to kind of think of that in this new normal of the pandemic. And just some tips for Halloween. We'll be putting some items on social media, so look for that. As I mentioned, if you're sick, stay home. Like, don't go out and give candy to the kids or host a Halloween party when you're having a fever. or getting family together. I mean, so just really skip the Halloween party if you're not feeling well, and get tested and take precautions in crowded indoor areas. And that's why I'm saying, I see the, make sure you just are aware of your surroundings and wear a quality mask. So detectors should still have sort of those, some of the KN95s and N95s that we've given out before, and they should be available. I'm looking at my notes here. If you're hosting a party, improve your ventilation. If you have a window, just open it. I know people are going to be mingling, maybe eating cupcakes or something. Just make sure you think of your surrounding. And we do underestimate ventilation as well. So encouraging people to look at improving their indoor air and also improving airflow is going to be very important. And then also keeping your hands clean, contain, and then one thing you can do is, like, if you have trick-or-treaters coming and you have a bowl of candy, of course you might have them pre-bagged and you washed your hands and you might put it in a sandwich bag, or you might have the trick-or-treaters sanitize their hands before they put their hands in the bucket of candy or whatever, or you can give it out to them. But find ways just to think of just hand hygiene in general when you're with your family, providing trick-or-treaters candy this year. And then also the trick-or-treats, I think it's just simple, same thing, just our 3 Ws: wearing your mask, watching your distance, and washing your hand as well. So those are just some quick messaging we have for the upcoming holiday here. And I hope everyone stays safe. Ashin Yamasandon Hinche Bon City Castle. I thought so. And I hope you guys enjoyed this. I know we've been out of this sort of going back into the new normal of COVID, and it's always nice to see people out there. And indoor. Thank you very much. So Del, take it away.
All right. Thank you, Dr. Jim. Hi, everyone. Happy Tuesday. Here's a couple information I'd like to provide here, but this is our report from last week, from October 7th through the 13th. We still have those numbers. Just go to this slide here. We are transitioning to weekly reporting. I don't know if that's been mentioned yet today. So the reason being is CDC and the states have transitioned already to weekly reporting last week on the 20th, last Thursday, which really impacts our epi reporting, especially daily reporting that we've been doing for all this time. So CDC and the states have transitioned to weekly, so we're gonna also move to weekly reporting as well. So so we did so already last Thursday. So our first weekly report will come out this Thursday on the 27th. And from there on, we'll report out every Thursday going forward. So, and the report period will cover the previous 7 days, which is a week. So just FYI, and also our Navajo Department of Health COVID dashboard will reflect the weekly reporting too. So just for everyone's information, our first weekly report will be coming out in a couple days on Thursday. So, and then just from last week, as been mentioned already, this is our 60-day time window here, recent cases and trends. As you can see, all the up and down variation in cases every day. The orange line is our 7-day moving average. As you can see towards on the right side here is a little uptick in cases. So when the report comes out this Thursday, we'll see what the new trend is like. But just last week, we did see a little bit of an uptick. And our case rate did go up as well for 7 days, 334 cases per 100,000 people. And then our percent staff beds, as Dr. Jim mentioned, this remains pretty stable, which is a good sign. Remains at about 1.7%, which is medium risk. It's not going up, so it's also a good sign at 0.65 admissions per 100,000 people, and that's medium risk. And then there were 530 new cases, which was a big jump upwards, plus 162% change from the previous week. And our 7-day lab-based test positivity, I looked at this yesterday. Last week was 13. I think this week's going to be up based on the numbers. The analysis yesterday was at 17%. So this 7-day test positivity, it's also going up. So we'll just have to monitor that going forward. Hospital bed capacity, however, is remaining stable, 53% and 50% for hospital beds and ICU beds respectively. And then vaccine coverage for our Navajo Nation residents, about 70% have completed primary series. And then the new bivalent booster definition, we are almost at 7%. I think this report will come out, I think today, if not today, tomorrow. So the updated number should include in our Thursday report. So this 6.7 will probably be higher. And then all the COVID strain surveillance is ongoing. I'll say a little bit more when I get to that slide. So 130,000-ish Navajo Nation residents have completed the primary series. Then about 12,522 are up to date with the new bivalent booster. And these numbers probably be higher with the new report. Just the entire pandemic, the epi curves, the yellow line is Navajo Nation, and you can see a little uptick here on the very end here on the right. So we'll just see what the new trend will look like on Thursday. And then this is our 7-day case rate, a big jump for us. So we're back at number 1 compared to the 50 states. And then I just updated this slide. Really within our region, New Mexico has really seen an uptick in cases. From what I've seen, their numbers. Also, Colorado and Arizona too are seeing a little bit of an increase in cases currently. Transmission remains high within our region. Only Navajo counties in this orange color, which still is substantial transmission. This will probably get updated hopefully tomorrow. But just the highlight here is the BA5 continues to be the predominant variant that we're seeing currently on the nation. Went from 496 to 510. Okay. Hi, everyone. Sorry, we're having technical difficulties on our end. So we're just going to transition to Dr. Fowler. Shema, please take it away.
Ich hätte ja hat technical difficulties hat nido dienst in Lini saho on dan sis condition be yelt higi kodon hil ishta ananil ne aro ich hätte hidi nido le ade da is noch sein die shito bezeta des bali unser na choshle asahan sesata akodi iltahi ein hinat ani Lini kodoyen hichahazi is that Lini ben up and has Lini the questions Hanas it's at Apedi Nini Nashni Naka Alne do dik at the question ni do Ajit Nashni Jo Edo Ajit Yayat do Ajit do Ze Baholo Okadi COVID-19 bedi Nini do variant bedi Nini is at ni it's on the not this kitchen Edo should ni na goiki Dio yo torge do hos torge do the ben saj aj ni hitsa the enana ni ako jo e kodo hanna eat ashi hona you in yat abaya dalki da do ninde jo hanna eat ero ba hono sendo beni yakodo hanna en lini ni hit in de in aro di monkeypox de nini jo llod ancha ja aje ati jo edo ati di betato na to na hoshi wanda ne jo edo aje is it baholno ati di ni hit nebel ha zorge ya ilne ati aro di na alchinin hi yajin hi away in lini hashin to godi ntati aso the kosen lini dots ni donal ni ado de kosen lini e nas ni ko o uni hinago na alchinin hi yaje dan lini beta del nato ze el igune yen ye yahanda ka jo edi ilchini yaje wel yeni hago da belin jikko da hakke da handa di ja alchoni yedilne ado ze alchoni ze je huyosen ako kheda da betkhane go da ilchini yajin lini yana gaho aja ayuwata betadilna ko eina na alchinin lini iltsabitni aho wadada nahaz khan ko shin jane jo edi khanana ni ilchine RSV de jo o de kosit konde ze pata honno olto ado dik at banata hui jiji belakana kato Halloween de ilchine choyine tlido khatadna don le hotraje el keste se da ishi da bechahotal ne ado konde yan ho wa de bitni nakha jabanda do khat ogot ehit ado the precautionary measures abe ta akosiado be yati ni na ani in the kanta di kash na horjish akogan khat ni che ni ma ni jen hi nal da en hi masan jo ho wan ligi past at the house di ade il kasi ben na at the house jon hitne ado is in lini aton na ha ne ko is na ha ne Aden di tra na chibi na ne ka kodo hot da dan hidi no ko an hin na ha se la shik edo shidne ado kodo Captain Brian Johnson and non hitne ad edi hos as bija dati ka ko o yushi ako ne da do le to ko ne ko ni tonchiti na ho wan has ango o yu ilki dan hi gan o ta konde ho wan na anash ko innocent tesson da onza an da i de kosantanas et adapedi ni atin jikish atinalto aro dit ini do de kosan lini jo edo kanana ni konde eze bahalo shik edo shitne akodi aj eze in aj yeda ani atinal ka do kujanal ka to bi adini ido eze in ka bel ihiln del nishon hilne akonde di eze benapin pa dal yai ati nin le hinago hot any o you ati is that Mahata net the Akon the here could the Nebel Zoje has twin hizani ati ize lini bahatal ne do you ita benapem bahatal ya ize lini ako ado ein hilnedik at holidays na da hoishis transita galcha ado keshmish ko oshi yugo hinna il dedo na da satokai o ha jobe ta akhwhia dan hiti nido dan hilne ado de khaslango dan jaga ad eto tinka do ne obe ta akhwhia ado hitchi dan hize abeta de spa khone na kha o na kha e sa khashine la e bez ani lini na da sos a konde be ta akhwhia ado te beats at da don le da got stantino anti beta khe Joko akwana tio AIC is the in lini naka adel no adol ni joko altona bedelne ako kwa yegonan ka ako din hit the nebel hazard ani o yuze in lini naka adal yande jonaka actionen in need no setliji bebel the hotne ako dize benapin ba alyage isla beda hedon le tatsata eda belana asli Adona hone eisiau en lini kodo yahanana zi isala de zel ijimanat ahn lini jo ahon wado ya nihin nahat saladon hin antkin sala ado ade ehon wadin lini gi jo ado na antkin hatahazla ako ko ehodol na oda jo be na ahin antkin nihiti ne ho wagonne ilhino ka dat no hi ho da jo subject ego Edi tesson dan lini onza ja ashdol li bitni lahona chigo ashdol ni ala di behes ani isolation de lene jo edo lahona nalia ako quarantine wal yene ek at naholia ako dik achi ashina ni ho gol ado le tutan zeil enedo yeda ani konde ni hibe eta ahuil yani jo e aje e nantin ado kodon hilkhanne idon hil ishtan alzeni jo edo bahuil neti izeil ene izetni kata dan lini ado nat ani dan lini halet e kodon hilkhanne dan lini o hayui jo kodon hil ishtan alzeni eight akoho wanahas ango jo an hin antkin nazla ako ado edi Halloween bedishnini ni hit khanes gegon hiyajen hi awe bethanes gego altebini ahon wadasata Adon le hotra kagoda o joshin rachne be ba holia bel da trado kaido safety hadne ado ahon wade da o tilta no son do chian ai dash eta yago jobot ado antla ilne ado kodoshi yaj ye hadzi eti raj yizle raj yizl qat etos edonde trat at da yor college eti nasni nal kai ya holne Akodita yahol na ekete at asa da mojik apa nahan neton hilne jo edi kinahat gaiden CDC da ita na tingo yo kase da tizli bi yelana da asli kodina ni na kaje edi ni hita modo tikichon aja shin yan da hal neto lenle so chije e hot anal katonal ni jo benina hot anige oyote des kidishi benna hot ananalia akoti asat da moje edi ishklat nezatino athatin akonella e benata dolna akonde ezel ebenhas ango e ati anahas antron hilne konde di ize benapen eliage o yun hitenen lini aida ba ta asido ye edo ye naskoshi ye nantin ado kwaelche nadia adon hitan kojet ya hadna koje oyon hitatnes akonde jo an hinit out e yashik edo shidne kodobe eta holiado be na hinatin kad ani kodon hinat ani in kad yenle kaden tratna khaj out aben nitin ko an hin ho wan hil nas angon hil bahazem hot an lego deia adodit ostoit ini benat sedi gishla ni hitchin hize betata des balin leon khaslango de khejohatne ado olchine elsa ahon wade kochiga ida dan da halni e ati agot chiyan dan da halnya ati antaht Leni hi ket an hago shish de yago kontinent lini o you o bol ni ho ta de jam le et ko da inji ka ni ken hi ket apen da asof ado wan ya ho je jo hot ashi be ta khaya sani jelon de net jelon ko a ta hat zi kha achine ko a we khaya je ta hono jo e be ba ho jelia na antkin et ato e As céide ben as an tinda alto, but ebe eta a cholia an isi ba a cholia arod ian sin ini chota sandla joga isi di de kosnat lida it's a chod ini a chod debe eta a chodzilia jo e chodo ben hiln da chwilne shik edo shidne ado ana chada ado yagota and le naslian hinago da honada zaigi o she yo aj ye go da hotza aj najo dato le jo e shi be ta a kholia a to be na a hin no thin jo hot a hot del na hot shi to it eda ja os del kosende khaje da le khan kesa o you going to eat kesa o ta go e shi be ta a kholia do shi e do shi ne a ko he a ne kana ta so yo gizi. Thank you for tuning in. We will continue our COVID-19 weekly updates on Tuesday. But, just to remind everybody, our EPI team will be doing a weekly update on Thursdays. Eshe kodo open hilpaho zendole. Ado data odana dat el khata tan hit no da e kodo ben hilna hotone. Juk ad e o hajo be eta akosia. Take care of yourself, take preventative measures. Know your 3 W's, wash your hands, keep your social distance, use your hand sanitizer, and make some really good decisions when you're traveling. Make some good decisions when you're going to travel. Have a safe and a happy Halloween with your children. I know children really look up to Halloween, but take preventative measures in some of these events you participate in. Linin hichonane yado le adon jonon heta do janshi na kasende jot 18 hakazin lini bich khachol no el to tan hit ni ko ye go ta ta hashik era shidna kol so do le to na ha